we go. And Jason and Greg, just so you guys know, folks are really busy and a lot of folks are working in the ED, so they'll kind of pop in and pop out. So we'll send the video out to everybody in case anyone misses any pieces of this conversation.
Perfect. Well, Amy, thank you so much for your kind words. I really appreciate it. And it's all, I feel the exact same way about you from working together. We've had a great time over the past few years and we've done a lot of great things and helped a lot of people. So I appreciate that, Amy. And I really appreciate you setting this up and, your phenomenal platform of Recover Well. So that being said,
Greg,
hey, everybody.
You're on mute. We can't hear you.
It's showing.
Your mic isn't working.
I can hear him.
Greg.
I can hear him. I can hear him.
I can hear him.
Oh,
It's only you, Amy.
You're on mute.
No, we don't hear
your
you,
audio might
Greg.
be off.
No, we do. Yeah, we can hear you.
I can hear him just fine.
Jason, are you there? Can you take over until we figure out Greg's microphone situation?
I just sent a message on there.
Okay, now I hear you. Does everybody else hear Greg?
Yeah, we've been hearing.
Oh, you have?
Yeah.
Oh my God, it's something on my end.
You
You're-
totally interrupted the flow, Amy.
You
I was
guys,
just saying, Amy, I was complimenting you the whole time and you missed it all.
oh no. Oh
It's
my
okay.
God. I love an unheard compliment. Okay. All right, you guys, sorry about that.
Well, I was just saying, I really appreciate you setting all this up, and we've done a lot of great work together over the years, and I appreciate the kind words, and thank you for putting together such an amazing platform, and this is just going to help so many more people and get so many more people access to great care. So I appreciate that. That being said, everyone, I really appreciate all of your time. I'm no stranger to the ED and the hospital, so I know you're all very tied up and busy. I won't take up much of your time. I just want to play a quick little video introducing Recovery Beach and our organization, and then I'll walk you through a little quick presentation, and please feel free at any point in time to stop and ask questions. Otherwise, I'll leave plenty of time afterwards to answer any of the questions that you all may have. So with that being said, let me just start this video. Please let me know if you guys can hear the audio. Everybody hear that? No? Okay, sorry. Hang on.
You're just gonna have to say it like,
Say it out loud.
ad lib, yeah.
It should be able to share audio on this too. Here we go. I think this should be it.
Recovery Beach is a well-respected and highly effective drug and alcohol treatment center that recently celebrated our 30-year anniversary. We have helped thousands of addicts obtain long-term sobriety because we focus on holistic, individualized care. We truly believe that all people have the capacity
I'm sorry, guys.
to grow and flourish once they break free from the grip of psychological and/or emotional challenges that have been negatively impacting their lives. This means that instead of just looking at the addiction, we take a comprehensive approach to addressing the underlying psychological and emotional aspects underneath it all. The staff at Recovery Beach are highly trained, compassionate, and dedicate their lives to helping those who want to live a life free from drugs and alcohol. After being admitted, we focus on medication-assisted detoxification, managed by our medical doctors and psychiatrists. Afterwards, we step down to inpatient residential treatment, where we inspire positive personal transformation and long-term recovery from addiction by encouraging hope and healing through evidence-based treatments such as group counseling and one-on-one therapy sessions. We also offer alternative therapies such as yoga, meditation, and art, which can be helpful in showing clients how to better manage stress and negative emotions. Clients will be provided a delicious, low-glycemic, dopamine-boosting, protein-rich diet. Recovery Beach is proud to be recognized by Congress and the City of Los Angeles for our invaluable service to the community. Our commitment to our patients is that their treatment experience will be centered around their needs and desired results. Everything at Recovery Beach is personalized for the client, and that comes through in our results. We have a very high success rate. We make the highest quality substance abuse treatment available for as many individuals as possible. As a result, we are one of only a handful of luxury treatment centers across the country that works with most insurance providers, which means minimal out-of-pocket costs for our clients. We also offer affordable cash pay rates based on a sliding scale. Don't wait another day. We have an incredible admissions team standing by 24/7. Regardless if we can help, we genuinely care, and we will point you in the right direction. So pick up the phone and give us a call.
All right, so I'm just going to switch over here and go through this presentation. If anybody has any questions, again, please feel free to stop me as we're going through.
Yeah, I don't really talk to cameras, so I'm having a conversation with two guys. So the cameras will follow me.
All right, there we go. How about that?
If it doesn't make dollars, it doesn't make sense.
That's right.
Do you guys hear that audio? That's not coming from my end.
All right now.
All right now.
Hang on. I think I'm getting an ad for something from the YouTube video.
To New Heights, ladies and gentlemen, presented by Wave Sports and Entertainment. Yeah. Brought to you by our friends over at Fireball.
Sorry about that. Okay.
Ironic,
Anyway.
Right? Brought to our friends by Fireball. My God.
Our facility is located in Garden Grove, California, dead center Orange County. What I really want to focus on is what we touched on in the end of the video, and what kind of sets us apart from a lot of the other treatment facility is offering a very high quality of care, individualized programming, and very, very accessible. So the difference between us and a lot of these other detoxes and inpatient facilities that you'll see is that we can be very open with the demographic that we treat. So when it comes to the people coming in, their insurance is even our self-pay rates, it's going to be significantly lower than most of the other facilities. And because of that, we're able to provide, again, a higher level of care, master's level clinicians, high level of medical care. And the biggest thing for us is just focusing on that individualized model. So a lot of these clients that are coming into treatment, they've been to treatment before. They have these cookie cutter, clinical programs where they essentially could run the show themselves because they've been to so many of these in the past. And with us, we create a very individualized treatment plan based on their history, based on their demographic, their use history, their medical history, any medical comorbidities, and create an individualized treatment plan that they'll get unique to any other program. We're licensed for 33 beds. However, with that being said, there's plenty of space at the facility. Realistically, there could be so many more, but we want to keep it at 33 because we have the ability to have more of an individualized approach, and the staff to client ratio is significantly higher than most other facilities in the area. Are the levels of care that we offer: inpatient detox and residential treatment. That means that clients coming into our facility, they're actively using substances, any drugs or alcohol. We can provide 24/7 med management. We have 24/7 medical on site, round the clock nursing. So anyone who is a bit of a higher acuity, if they're suffering some severe alcohol withdrawal, benzo detoxes, opiate detoxes, we are fully staffed and outfitted to treat those types of clients. Oftentimes we'll have clients coming in after hours as well. So that's one of the biggest things for us too, is to be available 24/7. And a lot of these other facilities, they're cutting off admissions around 10-12 p.m. So what we would do is if we get the call, it'll go to one of our admissions team. We'll be available, we'll be able to approve it, and we can discuss a little bit more what that would look like through the Recovery World platform. We're offering medication-assisted treatment. So clients coming into our program, they can stay on MAT, usually Suboxone maintenance. We're also offering the Sublocade shot, so we could do that on site. And clients leaving our facility will be offered the Vivitrol shot as well. So if they've completed 30 days of treatment, they'll be able to leave with the Vivitrol shot, as well as a referral to an outpatient program that would continue with Vivitrol. We do a lot of family integration. So we want to make sure that we get the family involved from day one. So one thing that we'll also do is get them involved for on-site family therapy. Our clinicians will bring them in once it's appropriate, usually within, the 3 to 4 week mark, once they're a little bit more stabilized and a little bit further along in their pause, we'll be able to bring in family and do some on-site family sessions. We emphasize dual diagnosis. So when it comes to the higher acuity mental health diagnoses, we're very comfortable and outfitted to treat those, assuming there is a co-occurring substance use disorder. Our medical director is a board certified psychiatrist, and she has 3 other providers under her psych NPs that are seeing clients in person, on site, not just telehealth. So they'll be able to do those psych assessments in person and provide any type of psych med management needed. So in most cases, assuming that they're not actively suicidal, psychotic, things like that, they're usually pretty safe with us. And we do a pretty thorough pre-admission assessment to make sure that's the case. If not, we can help make a recommendation to a mental health program. We do a very emphasized approach on trauma-informed care as well, and this steps into our latest endeavor as far as offering veterans programming. So any veterans that are coming through with PTSD, even civilians, regular clients that come in with a significant history of trauma, we'll focus on that in their treatment plan as well. And then we're offering a lot of holistic therapies too. So we're doing yoga, mindfulness. We do sound bath every Friday. So it's again, a very full faceted approach, making sure that we're doing mind, body, soul, everything. Art and music therapy. And then one of the biggest push towards the end of our program is making sure we're emphasizing aftercare planning. So every client that comes into our program, we understand that, 30 days of inpatient treatment is just the beginning. So we're going to make sure that all of our clients are getting set up with a referral to an aftercare program. And 9 times out of 10, we're doing a direct bed-to-bed transfer into a PHP level of care. So it's a little bit about our facility. I mean, you saw the video, you see what it looks like. Very comfortable, nice amenities, double beds. This is the kind of thing that you're not going to see in facilities outside of the typical high-end 6-bed Malibu detoxes that we're seeing in LA. So these types of things, the amenities that some of our clients are coming in from other states or even just coming in off the streets, they're not used to getting this type of stuff. So we just understand that early recovery is so, it's so volatile at that point. So we want to make sure that they're comfortable and they're getting all the things that they need to be comfortable, especially throughout that early stage. A little bit more on the facility, a lot of outdoor space. So we emphasize, sun, healthy living, fresh air. This just goes on to a little bit more of our levels of care. I do want to emphasize the full continuum of care approach. So we're not just offering, 12-step programming, again, very individualized. So clients coming in, they'll be able to have more of an input on their actual treatment episode. That being said, we're also making sure that we're holding necessary boundaries as well. We do have a lot of clients that come in that have been in treatment quite a bit of times, and they like to dictate their own treatment planning. So we do a pretty good job at, the educational piece and motivational interviewing. And, if somebody comes in and says, hey, I just don't do 12-step, that doesn't work for me. Okay, let's find some type of program. Let's make sure you're doing some type of outside meetings, whether it's, 12-step, AA, NA, Celebrate Recovery, anything like that. There's a lot of things that are offered in our area, and the area that we're in, it's big recovery community. So there's more than just one approach to it. So we want to make sure within and without of the facility, we're able to offer them that individualized treatment plan. So we have a full-time chef. All of our food is made in-house, very healthy, whole foods, mixed diet. We're offering protein, vegetables, healthy carbs, complex carbohydrates in every single meal. We do have a couple of clients that have come in the past with history of, I would say secondary eating disorder. We don't treat it, but we have the ability to make sure we're monitoring that, and we can offer them a healthy diet and a healthy lifestyle. And again, with insurances, we're not insurance selective. So, a lot of times you'll see different facilities that will turn away a client because they don't have a certain type of insurance policy. We can work with most, and we can also be very flexible when it comes to out-of-pocket deductibles and things like that. We've been able to work with a couple of Recover Well referrals in the past, and each time we've been able to be, pretty accommodating when it comes to the patient responsibility on their insurance. And I would say 9 out of 10 times, given, the criteria for treatment, we'll be able to bring somebody in at no cost. This is how you can reach us. I know that all of you do the referrals through the Recovery Well platform, and we're checking that 24/7. So if we do get a notification, one of our after hours admissions reps will see that, and they'll be able to reach back out to you and get that situated. If you need any direct contact, of course, you could always go through here, but I think, through the system, it would be best just to make sure that it's all tracked appropriately and our team is notified and we can get back to you in real time. Our location, that's our address. The website is there as well, and there will be a link to that YouTube video that you guys had. And we like to show that video to any clients who are prospective that are looking to come in. We're also happy to speak with them and present a little bit more about the program over the phone. And if it's possible and if it's required, we could also set up tours, and we can, usually bring a rep into the hospital to speak to someone if they're admitted and they have a little bit more time. We like family contacts. So if they have emergency contacts that want to hear about the program that are helping with the motivational piece, then, we'll do the same for them as well. So I'll open up the floor to the team. If anybody has questions, I'd love to get deeper into it.
I just want to reiterate one fact too that Greg mentioned with out of network. When you see their facility out of network, Greg and Jason have been very accommodating of patients and will continue, I'm sure, to be very accommodating of patients, and have said to me over and over again, they don't want costs to be a barrier. You guys know that when patients have commercial insurance, they have a contract with that policy holder, that they have a either an 80-20 policy, meaning that 80% of the services are covered, with 20% being the responsibility of the patient. And then they have a copay, or excuse me, and then they have a deductible. And those are contracts between the patient and their insurance provider. But Greg and Jason have been very good about making sure that those fees are not standing in the way of someone getting treatment. They're very flexible in payment schedules, payment plans, offering reasonable scholarships and things like that. So if you see them as out of network, don't hesitate. You never know. It doesn't hurt to ask and see if there's a way to get that patient in the door at no cost. That's always my goal, is to make sure that our patients have as many no cost or low cost options as possible, because we don't want price to ever be a barrier. So there's that. And then also, I remember in our last conversation, Greg, we were talking about, I have a lot of folks in the LGBTQ plus community and my concerns about safety and being in environments where they're safe and well cared for, and those needs are being met. And I remember you guys just being so kind about how much love you have for that population. So can you speak to that a little bit?
Of course. Yeah. So we have historically treated that population since inception, and we do everything we can to make sure that, again, the accommodations are made for the utmost safety and comfortability of the client, along with the rest of the community as well. To give you a little bit of an idea of how the facility is laid out, we're essentially, imagine apartment complexes, as in each individual living space is a full unit, as a 3-bedroom apartment. So in each 3-bedroom apartment, they're gender specific, and in each 3-bedroom apartment, one of those rooms is a private room, meaning it's just a single bed with its own individual bathroom. And we reserve those for any instances of whether it's, severe history of trauma, any severe medical comorbidities, and then also in the LGBTQ population, if there's any instances where they may need some added privacy for their best interest. And oftentimes that's what we do see, is we'll have a individual call in, and that'll be the accommodation that we'll make for them, because it's best for them in their treatment episode. And because of how many of the individual rooms we have, we're usually able to make that happen. And if it's a regular, and I don't want to say regular, but if it's a client with no outliers in their history and no, again, severe medical complications, then we don't typically promise or offer individual rooms just because they want one. We reserve them for these types of situations. So we haven't had one yet where we haven't been able to make that accommodation.
Okay, I have a
on the
question.
other side of it too is with the actual clinical care, and on the clinical side is we have an emphasis on trauma in the programming. Our clinicians have extensive background in treating the LGBTQ population, so their actual treatment episode is going to be geared towards that. And the one thing that we also do is work with a lot of local aftercare programs that have LGBTQ programming, so we make sure that the aftercare plan is consistent and they go through that full continuum with the continuity of care based on their clinical program.
Valerie had a question, I think.
Actually, it was caught my attention when you said medical treatment, that you offer medical treatment. And, that's one of the big barriers to placing, clients or patients in in treatment is the fact that they have comorbidity. You know, they have sometimes abscesses, open wounds, etc. So you did mention something about medical treatment. How does that, is there a doctor? I mean, you do accept people with medical diagnoses?
Sure, of course. So it's always going to be a case by case. So we'll have to do a pretty extensive background. And of course, if you guys are sending a referral, we'll have the medical records, which always helps in that case. But they have their physician. The physician will be seeing them on site. So again, it really depends on what's going on. As far as open wounds, that can be difficult from time to time because they're still in an open population. They're not in a hospital. So it really depends on the severity of something like that. But for other things, even if it's managing things like I mean, I'm trying to think of some examples, but we have
Like
some clients that come
HIV
in that have some, I'm sorry?
Yeah, like HIV, sometimes, of
Yeah.
course, yeah, very
Sure.
common.
Yeah. So of course, so that obviously we would never disclose, and we have had clients come in with HIV diagnoses, and we have a client currently that's type 1 diabetic, and it was very unmanaged when they came in, and now through our time in the past 3 weeks, we've worked on again more so motivation, but also education to make sure it is managed a little bit more effectively, so they're compliant with their medication. So those are the types of things that, although it's not the actual target of our program, we're able to work on that kind of stuff. So we even had a client that had called in specifically for med management stuff outside of substance abuse, and there was a co-occurring substance use disorder. So because of that, it was a good fit for our program. But I think what they really gained the most from was having that extra accountability. So that way, when they left here, they had the tools to be able to effectively manage their medication protocols.
Absolutely. Good.
Too, in terms of Recovery Beach, they're one of our more flexible programs. Like, so in the form, when you're ticking the boxes for if they have a PICC line or they have HIV, they have Hep C, they have different like staples, sutures. So all those things in the physical comorbidities, Recovery Beach is definitely one of our more flexible and accommodating programs for those kinds of more acute, but not so acute that they're going to be able to do skilled nursing. So they're definitely much more flexible on those things because they have so much clinical management. So definitely, if you're going to match to Recovery Beach when you have a patient that has high acuity concerns like that, you'll want to apply and see if we can get them in there, because they do have so much medical supervision.
And on that, I will say we make decisions very quickly, so we can run it up the chain. We can get the information to our medical director if it's one of those more questionable cases. So we won't hold up your team either. We'll make sure that you guys know as soon as possible. So if for whatever reason it might not be manageable in our care, you guys can find other options.
Yeah,
Do
and
you
I'll
also
work with you guys
accept-
on that as well. So anytime a patient comes in and I see them there, I'm always thinking, like, what's the backup option going to be for that patient if it doesn't work out at their first choice facility. So, yeah. Anyway, I cut someone off. Who was asking a question?
That's okay. I was just real quick, because I know there's probably other questions, but as far as accepting people transferring from a different detox, maybe a different, that's part of the in-network thing? I mean, can we do that?
So so if a client is in another facility, another substance abuse facility, we can accommodate those transfers. Again, we kind of have to look at the situation. Is it because they're just not happy and they want to go somewhere else, or is there a reason for the transfer? We don't like to assist in a client AMAing a facility just because they're not happy with the way it looks, or they're not getting the cell phone use they want or something like that. But usually, if in other cases, of course, if for whatever reason their needs are not being met in another facility, we're happy to make that transfer, and we'll do a door-to-door transfer. We can provide transportation with our staff to make sure that there's no hiccups in the process.
Okay, thank you.
Of course.
Anybody else have questions or have a use case that they might want to talk over?
No, I think just Greg should mention about, about out of pocket. Sometimes there's out of pocket and there's deductibles, and sometimes clients will be very afraid about paying those fees, but we're very accommodating to try to help people with all of any out of pocket expenses.
Yeah, so we had covered that on the presentation, Jason, but yeah, I will reiterate, for any out of pocket costs, whether it's a deductible, out-of-pocket max, we're very accommodating with those. So if you do see someone's insurance and you see, $5,000, $10,000, don't be deterred. I would say, let us take a look and look at the criteria, look at the client. And if it's a good fit, we can do our best to make accommodations. And like we had said during the program, most of the time, I would say 9 out of 10 times we could bring someone in with no cost to them.
Yeah, and let me just have you talk about that just a little bit more in depth, because most of the patients that we see, as you guys know, about 70% of our patients are going to be Medi-Cal and Medicare. So the ones we get with commercial insurance policies, they're really at their rock bottom. They've already tapped every friend and family member for resources. So let's say, for example, I put a patient in the system and it comes back that they have a $5,000 copay deductible total, so it would cost them $5,000, right? And I know this patient does not have 2 nickels to rub together. Should I just put in the chat portal like, hey, this patient doesn't have $1 to their name. What do we got to do to get them in there today? What are some of the ways that you can work with those patients?
Sure. So I wouldn't even say it needs to be said, because we're already mostly assuming that people don't have access to thousands of dollars to come to treatment. So if we see that, right, and it's a case where we can make accommodations to work with them, we'll just let you guys. We're assuming that's the case, is what I'm trying to say.
So
However,
you'll put a scholarship into the platform saying like certain amount.
Yes. Yeah. So when we see that, just so you understand our process, when we get one of those coming through the platform, it's I myself that looks at it. So I'll pull it up and I'll run the insurance information on our end, and I can see a detailed breakdown of the out-of-pocket expenses, what has been met and what hasn't been met. And then from there, we'll get right back to you. I mean, it's a 2 or 3 minute process because it pulls instantly on our portal, and then I'll get back to you and let you know. Let's say again, $5,000 deductible, $10,000 out of pocket. I can say, $10,000 scholarship, however it is that's best that you can understand that it would be no cost to them. But yeah, we'll go through that scholarship portion and fill in those fields so you can see.
And if there is a patient that you can't reasonably scholarship all of those overage costs, are you able to do like long-term stretched out payment plans, like just a few bucks a month to get them paid up and all of that later?
Yep. Yeah. So we can do a couple of things. We can do long-term payment plans. On our website, there's also a financing option too. And that can apply to not just, the out-of-pocket costs, but if we have someone with no insurance, no Medi-Cal, no Medicaid, or even if they are underinsured with Medi-Cal or Medicare, even though we don't accept those, they can apply for funding there. And that can cover, a more gradual long-term payment plan. And when I say payment plan, it's not like they're getting indebted thousands and thousands of dollars. It's a very reasonable cash pay rate that they can pay back over time with no set deadlines. If you miss your payment, then you're going into collections, things like that. We can work with most people on that type of stuff. So if anybody is interested in that, they can pull that up on the website, and there's a link to the financing option.
And I'll tell you guys as well, on the handbook that I send out to all of our social work and case managers and sons, there is a page, I think it's like page 11. And if you don't have this version of the handbook, let me know and I'll send it to you, the new updated one. We have RecoverWell works with the Covered California program. We have a gentleman that works for RecoverWell through the Covered California that will help any patients that come in that have family members and they have maybe some way to get insurance, but they really don't have a lot. Covered California can set them up on these very low cost insurance plans, and they can be activated pretty quickly. So sometimes what I will do is I'll set them up with Covered California, and while we're waiting for the insurance to kick in so that they can go to an available bed at a low cost facility like Recovery Beach, we'll do some kind of detox program like MAT at home, or we can do a couple of weeks at a Medi-Cal facility. But as you guys know, those beds are so hard to get and they are often on a wait list. So, if there's a patient that has some means, not a lot, we can set them up with a Covered California plan. And we're talking like $57 a month to start. So a lot of folks, they can come up with $57 to start off on that. It's just that there's usually like a little incubator period where they can't activate it the same day. And it's all through the state. So, and a lot of people just don't know about it. So it's on our handbook. So I think it's page 11, and it talks about insurance and how they can reach out to the broker that works with us to help people get coverage for cheap. So yeah, so there's that. But then the other thing is, a lot of the facilities that I work with, and I'm sure Recovery Beach will say the same, is that, you know, as long as we're sending them a good amount of referrals, sort of like a co-op, eventually, if they've got enough wiggle room, there may be an opportunity with them as well for those scholarships. So we have some facilities where we've sent them enough patients that they're like, okay, your next one that you need, even if they're Medi-Cal, it's on us because you have sent us a lot of patients. So I always say, Recover Well as a network, look at it as a co-op opportunity. The more we can collectively, all of us together, really utilize the private pay space, the more generous they can be to our Medi-Cal patients. We all know that there's a huge discrepancy in the care that our Medi-Cal patients get. And my huge goal is, you know, if we can really support that private pay sector, the commercial sector, they're going to be generous to the patients that we really work the hardest for, which is our Medi-Cal patients, our Medicaid and our Medicare patients. So I want to like reduce that barrier as well. And I know that Greg and Jason want to help us reduce that barrier as well. Of course, in order for them to keep the lights on, I have to send them a good amount of commercial pay patients too. But the generosity is out there. Every facility that I work with is like, yeah, Amy, if I can get to a place where I'm pretty sustainable and I can afford it, I will give you a scholarship. So believe me, I will be taxing Greg and Jason hard after a few referrals. I'm going to say, okay, when are we going to get that scholarship for our next person who really wants and needs the help? So Greg, Jason, I'll be hitting you up for that. So.
Please do. Well, on that note, I will say we're happy to help. You know, we're one of the few facilities that are lucky enough to have, 33 licensed beds on one site. So because of that, we have plenty of space. And I would say most times about 10% of the census is a scholarship. So because of that, you know, we want to be a resource to the community. We want to help the local community. And yes, we do provide a level of care that most of the other Medi-Cal facilities do not. However, we don't want to limit that just because they don't have access to the same, funding, the same payer source, the same insurance. So when there's a way, we can make it work with you guys, and we're happy to be a resource to you and your patients.
Yeah, so when you have those cases, let me know. I will spread the word around that we've got a real need for a scholarship, and one of these amazing facilities that we work with hopefully can help us get that done. And one of these days, it's definitely going to be Recovery Beach. And don't kill me.
Stay on that note too. Our location being Garden Grove, we're centrally located, but we do transportation everywhere. So if anyone in the state of California, I mean, we've brought in clients out of state as well, but all of your hospitals are within driving distance. And even if it's a little far, we have the staff to be able to do a pickup. And we always like that door-to-door transfer. So if they're getting discharged, or even if they're just in the ED and they're walking out, we'll make sure that we have a driver to come to pick them up, whether they're 10 minutes away, 20 minutes away, an hour away, even further. So don't hesitate to ask, just because we're a little bit further away from where you guys are located.
Yeah, if anybody wants to drop in where they're located, I'm going to share with you guys everybody's the list. Everybody provided the hospital they work at and their email. So I'm going to send those things along to you so you can send them their gift card for coming in. I'm going to do our raffle. I'll leave the video going for a little bit longer if you guys want to stay on and ask more questions, but in the interest of time, I'm going to do the drawing. And
so it is, my sister was running a program like this.
Perfect. Oh, okay. Okay, here we go. And let's see, who is it going to be today? Michael Diaz, are you here? Let's see. Michael, are you here? You are here.
Oh,
Hi.
yes. Hey, so can you hear me?
Yes, you're the winner today.
Wow,
All
thank you.
So everyone, thank you so much for being here. If you need to drop off, drop off. If you want to stay and ask more questions, if Jason and Greg can be available, great. Next week, I think we're off. It's the 4th of July, so we took a week off. But then we're coming back and we'll have a Medi-Cal provider on the next one. I forget who it is, but you'll get the emails, and just make sure you keep your account activated, please, by just logging in. You don't need to put a patient in the system, just log in so that we can keep you on the platform and keep you on our email list. So anyone got any more questions? All right, I think we're good. All right, everyone, have a beautiful weekend. I hope all of you, if not most of you, are getting a nice long weekend and get to enjoy a couple extra days off.
Thank you all for your time. It was a pleasure.
Thank you. I'm grateful for all the work you
Thank
guys are
you.
doing out there.
Yeah,
keeping
thank you
us
for all the
all
information.
safe.